30 in active practice, and I'm still a dentist, but I consult and work for Safe Water. Mercury. It sounds kind of strange, but I started with an organization called the International Academy of Oral Medicine Toxicology, and they are basically looking at how poisons work. And mercury was one of the things I was concerned about, and what immediately pops up is fluoride, because it's a real nasty poison. And so, you know, we started looking at how it damaged thyroid and bones and brains and all that stuff, and you say, well, this isn't a good way to prevent dental disease. Not at all. It's a dangerous way. So. You'd have to ask them that, because I hate to ascribe somebody else's motivation, but I think money might have something to do with it. I don't think there's any reason on God's green earth why they should, you know, if they really cared about people and kids, and it's just a way for industry to get money laundered by the ADA. You know, it's a fake program. You know, as a dentist, I got to see people with cavities that brushed, you know, 3 times a day with fluoridated toothpaste. And, you know, it wasn't until we actually started studying what caused tooth decay that we realized that, you know, there are a lot of things that stop tooth decay in its tracks. Boom, no further tooth decay problem, and it's not fluoride. And so, 1, it's ineffective. 2, it's dangerous. And so, you know, why would you recommend it? So, as a dentist, I say, you know, choose something that's safe for children to use.
Right, absolutely.
Read the toothpaste tube. It's got the same warning on it you'd find on a .38 caliber pistol. Keep out of reach of children. Actually, it accelerates gum disease, so I would say, you know, it causes different problems, but it doesn't work that way. It's not effective. It's not. There's a study of babies where they had them and dabbed their little front teeth. They're at the rabbit stage, where they got 2 upper front teeth and 2 lower front teeth, and they're engaged in high-risk behavior, which is called going to bed with a bottle of sugar milk or something like that. And they used 3 different levels of fluoride and iodine, and none of the fluoride levels had any measurable impact on the tooth decay expected in these infants, and the iodine reduced the expected tooth decay more than 50%. That is almost 60% reduction. Why aren't we recommending that we do that? How often did they do it? Every day? No. Every week? No. Every month? No. Every 2 months, they dabbed their little teeth with the iodine, or the 3 different levels of fluoride. Only iodine had an impact. It had a tremendous impact. We need iodine. It's a nutrient. Fluoride is a poison.